As you know, the multiple myeloma, mainly the symptomatic disease, is based on the CRAB criteria, but also we have 3 new criteria. One of those is the MRI of the whole body, and if you can see 2 focal lesions or more there, then it is a criterion of starting therapy. So the imaging is going more and more into the definition of myeloma, but also the definition of response. Starting from the diagnosis point of view, in order to say that the patient has bone disease, you need to establish the lytic lesion. I think that one of the best exams, and a rather cheap one I would say, is the whole body low dose CT. So it's the computed tomography of the whole body with low dose radiation. And the patient can stay in the machine for less than 5 minutes, and you can have a very, very nice depiction of the lytic lesions in the whole skeleton. If this is negative, then a whole body MRI is needed, because the MRI, and this is something very important for both patients and the doctors, the MRI depicts what's happening in the bone marrow. It cannot show lytic lesions, it cannot show the bone themselves. It can show the infiltration of the bone marrow that can be focal or diffuse or variegated or normal in multiple myeloma. So I think that when you have 2 focal lesions, then you need to treat the patient in the absence of lytic bone disease, which is depicted by whole body low dose CT. On the other hand, if you want to capture both, then a PET-CT can be of extreme value, because with a PET-CT you have the active focal lesions on the one hand, on the other hand you have the lytic lesions, which is, let's say, depicted in the CT part of the PET-CT. So if you want to combine everything with one technique, I would say for the standard population, a PET-CT, if it is reimbursed, then I think it is a very nice technique. Now we have started to have a more, let's say, functional MRI also that have started in our center. Also the UK has a lot of experience with very good clinicians there, like Christina Messiou, who is doing an excellent job. And with the functional MRI, which is called Diffusion-Weighted Imaging MRI, you can also have a very nice depiction of the focal lesions and also of extramedullary disease without any radiation. However, this technique has to be standardized, because it has not been standardized yet, and also to be compared with the PET-CT in a randomized fashion in order, or big trials, in order to know the advantages and disadvantages, mainly in comparison to the PET-CT. The main reason that I mentioned that is also because in the follow-up of the patient, PET-CT has an established role, and the International Myeloma Working Group has included the PET-CT as the imaging minimal residual disease technique in order to reveal MRD negativity. So if a patient has an MRD negativity in the bone marrow, then he needs to have a PET-CT in order also to have MRD imaging negativity.